Coming on for my update. I'm going to wing this. I'm not sure kind of where I left off, and I know there's been a bit of delay in me putting these videos up, but after I explain everything, you'll understand why. So, the Sunday of Easter weekend, we went for our first beta. At that point, I had like 6 positive pregnancy tests. Things looked good. I was excited. I was planning ahead and getting ahead of myself, maybe. Anyways, went for first beta. Was having tons of symptoms that I had in a previous pregnancy with my son. So that afternoon, like we went for the blood work in the morning, and they called me, I don't know, midday with the results, and my first beta was 32. At that point, they were like, well, you never know, but I just bawled and bawled and bawled and bawled and bawled. I just was devastated, lost, confused, frustrated. I know from our first beta with my son was 240. So 32 and any of the other previous cycles I've done was not good. So we had to repeat the beta in 48 hours. I went back the Tuesday after the Tuesday after Easter. Sorry, I'm just trying to get it so that I'm not so dark. The Tuesday after Easter, we went back, and the second beta was 47. So it had gone up, but my clinic had said, it's not a viable pregnancy. So I'm not sure why it's so dark. There we go. Maybe a little too bright now. But anyway, they told me that my pregnancy wasn't viable, and basically to repeat beta in a week. And they told me that I would just miscarry. So I waited. It was like the Friday after. Sorry, I'm just trying to think in my head. I'm really sorry. It's been a long process. So sorry, I went back to work the rest of the week, and then I still hadn't started to spot or bleed or anything by the Friday. So I called my clinic and I told them, I'm not sure. Normally when I stop my progesterone, it's like 2 days and I start to have my period. So she told me if I had any pain over the weekend to go to the emergency room right away. And if I still hadn't had any bleeding, to go or to call them on the Monday. So that would have been almost a week past my second beta. I was supposed to go that following Tuesday anyways, like a week past the second beta to have like a follow-up anyway. And so the Monday I still hadn't been bleeding. I'd had a little bit of cramping. Anyway, I went the Tuesday morning and had blood work done. And an ultrasound. Because they were wanting to see what was going on in my body. So as far as he could tell, there was no gestational sac in my uterus. I would have been just shy of 6 weeks at that point. I basically would have been 6 weeks pregnant. So he was not seeing, a gestational sac in my uterus. But he couldn't tell if there was something in my tube. My ovaries were still a bit enlarged. I had cysts in both ovaries. This left ovary, where I've been having most of the pain and discomfort, there was two quite large cysts, and my tube looked inflamed, and it looked like, I may be saying the wrong words, but like hydrosphinx. I don't know how to pronounce it, but basically it looked like my tube was large, like right where it would have attached to the uterus or to the ovary, or by the ovary. And he thought maybe that there was some fluid in there. So then he became concerned that it was ectopic, because he said that because there was swelling and some problems with the tube and the ovary on the left side, that even if they had placed the embryos, which they did, in the correct space inside my uterus, the negative pressure from my ovary and tube could have pulled the embryo in towards the tube. So he basically said, you know, we'll see what your numbers are, we'll see where your progesterone's at, we'll see where your, you know, HCG levels are at, and then we'll go from there. So they called me later that day and they said my HCG had gone up. It was at 125 or 145, something like that. So it had continued to rise, not properly, but it still had continued to rise. And that my progesterone had dropped, but not significantly. So they wanted me to come back in 2 days again. So this was yesterday, in order to get my HCG level checked again. Now on Tuesday, they'd explained to me that if my levels on the Thursday had not dropped significantly, that I would have to take methotrexate. Probably saying that is wrong as well, but if you look it up, it's a medication that's taken when there's a risk of ectopic. So basically what that medication does is it attacks the cells within the embryo to make sure that they don't continue to multiply. And it's essentially, what I was taking would be a small dose of chemotherapy. So he did not want to have to give me that unless it was absolutely necessary, but he was going to go be on the cautious side, and if it needed to be done, he was going to do it. So on yesterday, I went back, and again, they kind of went over that. They went over that because I hadn't started to spot or anything, and that, you know, things weren't really changing, that they were worried that there was still something growing. Not properly, but something somewhere. Long story short, they called me back. My HCG levels had plateaued, so I had to take this I don't remember how it's called. Like, my mind is just overwhelmed. So it was an intermuscular medication. So luckily my sister-in-law's a nurse, so she came over and gave me that medication because my husband couldn't do it because he went to work last night. I had horrible cramps today. I finally started to spot. So everything is over for us. Our journey is over. I'm devastated. I've been crying a lot. It's been very hard for me because our journey is over and we know that. But it's very hard for me to accept because we've been through so much. We're blessed because we have our son, and I know that. But it's hard to give up on the dream of another child. But we know that our journey of having our own child, another one of our own children, is over. We basically have put ourselves into dire straits financially. And we just would be irresponsible to do any more money-wise that way. So that's my update for now. I appreciate everybody that's been commenting, and I'm sorry I haven't responded, but I hope you can understand that I've been through a lot. I have been checking out others' videos, and I do watch them on a regular basis. Sometimes I don't comment, but I do watch them, and I am, you know, praying for all of you as well. So I hope this video finds you all well, and I ask that you keep me in your thoughts over the next little while until I'm able to, I guess what you would consider, move past this. So take care, and I plan on keep doing videos. I'm going to do the tag that one of you has sent me, just out of curiosity's sake and interest sake. So, all right, take care for now, and if you have any questions, let me know. Bye for now.